Today in this short clip we're going to explore how we can maintain good blood glucose control before, during and after physical activity. The advice and recommendations given today will need to be adapted for your individual circumstances, but hopefully there'll be a few top tips to get you started. It is recommended that children aged between 5 and 18 years of age should engage in moderate to vigorous intensity physical activity for an average of 60 minutes per day across the week. Taking part in a variety of different physical activities across the week will help to develop movement skills, muscles and bone strength. For children and young people with type 1 diabetes, exercise requires some additional planning to keep blood glucose levels in range. But this should not stop you from enjoying or participating in regular physical activity. Physical activity may cause your blood glucose levels to rise or fall depending on the type of activity, duration and timing of activity after food. The effect of physical activity on blood glucose levels will be different for each child or young person. We advise regular checking of blood glucose levels before, during and after physical activity. There's two different types of activity: aerobic activities and anaerobic activities. Aerobic activities are activities which are longer in duration and more of a continuous pace, which can cause blood glucose levels to fall. For example, jogging, skateboarding and cycling. In aerobic activity, the body uses glucose in the blood and glucose stored in the muscles and fat stores as its fuel source. The activity can then cause the insulin to work more effectively and moving glucose from the blood into the muscles. Reductions in insulin or additional carbohydrates may be required to maintain blood glucose levels, particularly for aerobic activity lasting longer than an hour. In anaerobic activities, such as sprinting, weightlifting, gymnastics, and athletics, which can all cause the blood glucose levels to rise. During these short, intense bursts of exercise, the body releases glucose from its stores so it can be used as fuel by the muscles. Stress hormones, such as adrenaline, often associated with match days and competitions, can also cause blood glucose levels to rise. Some individuals may need to adjust their insulin to prevent high blood glucose levels. What you might find is lots of physical activities such as team sports, for example football, basketball, hockey, all contain periods of both aerobic and anaerobic exercise. So we would describe these activities as mixed activities, and they may cause your blood glucose levels to rise or fall. You also may notice your blood glucose levels affected differently on training versus match days. Aim for a blood glucose level before and during exercise of between 5 to 8 millimoles. Remember to check your blood glucose levels before and try to test every 30 minutes during the activity to help you understand your body's response. Children and young people with diabetes should consume regular, healthy, balanced meals. Meals before planned physical activity should contain a protein, slow-release carbohydrate, and ideally should avoid high-fat foods. Meals you could try include porridge with milk or a chicken or tuna sandwich made with whole grain bread. Exercising when you have insulin on board, for example, when you exercise soon after a meal and still have some rapid insulin in your system, may result in a greater risk of hypoglycemia and a greater need for carbohydrate to offset the insulin on board. This variable means that doing the same exercise but at different times can result in varying effects on blood glucose level, so it's essential to know how much insulin you have on board at the start of the exercise. When preparing for a training session, try to aim to have as little insulin on board during the exercise, especially if you're concerned about going low. This means giving thoughts to the timing of meals and insulin boluses, and also giving thought to pre-exercise meals. Recommendations before and during physical activity. If your blood glucose level is below 4 millimoles, treat the hypo following your usual guidance, and then start or continue with the physical activity once your blood glucose level is above 5 millimoles. Just be aware you're more likely to have a hypo again before or after the exercise, so don't exercise on your own. If your blood glucose level is between 4 to 5 millimoles before exercise, have a small snack containing 10 to 15 grams of medium-acting carbohydrate. For example, a cereal bar, small banana, or a small box of raisins. If your blood glucose level is between 4 to 5 millimoles during exercise, use 10 to 15 grams of a fast-acting carbohydrate. For example, 150 ml of Lucozade Sport or homemade sports drink. Dextrose tablets. Please check the packaging for carbohydrate content, as this will vary depending on brands. If your blood glucose level is between 5 to 8 millimoles, This is the ideal blood glucose level to start physical activity. For physical activity less than an hour, you may not need any additional carbohydrate, but you may need 10 to 15 grams of fast-acting carbohydrates at the start if you've had a meal in the last hour with the full insulin dose and not reduced in preparation for the physical activity, or if you have found that doing physical activity in the past has caused low blood glucose levels. For exercise over an hour or high intensity exercise, you may find you will need 10 to 15 grams of fast-acting carbohydrate every 30 minutes. If your blood glucose level is between 8 to 14 millimoles, go ahead and exercise, but drink plenty of water or sugar-free drinks before and during the activity. If your blood glucose level is over 14 millimoles, make sure you check for ketones. If your ketone level is more than 0.6 millimoles, do not exercise, but give an insulin correction dose as advised by your diabetes team, and wait for the ketone level to fall before exercising. If your ketone level is less than 0.6 millimoles, go ahead and exercise, but drink plenty of water or sugar-free drinks before and during. If your activity is within 90 to 120 minutes of a meal time, you will need to adjust your insulin. If you experience blood glucose levels regularly under 5 millimoles, you will need to adjust your insulin. We would advise starting with a 25% reduction in the mealtime bolus insulin and to monitor the effect. Some activities may require a larger bolus reduction and others may not require a reduction at all. For example, any anaerobic activity. Recommendations after physical activity. Check your blood glucose as soon as possible after the activity has ended. If your blood glucose level is high, consider the reason why. You may want to consider the following strategies. Reducing the amount of carbohydrate before or during the activity. Consider giving half your usual correction dose if levels do not start to drop after a few hours. 10-minute cool down, so for example stretching or walking to help reduce the high blood glucose levels. If your blood glucose levels are low after activity, consider the reasons why. Was it the type of activity? Was the duration longer than planned? Did you not eat enough carbohydrate? Or did you maybe need a larger reduction in insulin? Check your blood glucose levels are above 5 millimoles and be aware that you may experience further hypos. If this occurs frequently, consider the actions to prevent delayed hypos. Preventing a delayed hypo. Hypos usually occur between 4 to 6 hours after exercise. You may need to consider one of the following strategies. The hour after physical activity, consuming between 10 to 20 grams of carbohydrates alongside a protein-based snack. For example, 250 ml glass of milk, yogurt with banana, or a protein-based cereal bar. You might need to consider a mealtime insulin reduction of between 30 to 50%, or a bedtime snack of between 10 to 15 grams of carbohydrate with added protein. For example, a 250 ml glass of milk, or a nut-based cereal bar, or a long-acting basal insulin adjustment. But please speak to your diabetes team for advice. Other possible golden snack ideas include yogurt and fruit, peanut butter on toast, cheese and crackers, or a fruit and nut mix. A few top tips to consider. Test your blood glucose levels more often before starting. Try to test at least every 30 minutes during and immediately following and 1 to 2 hours after activity. Check your blood glucose levels before bed. Ensure you always have a supply of hypo treatment and additional carbohydrate-rich food. Make sure you drink plenty of fluids during and after physical activity to stay hydrated. And just a few final points to remember. Absorption of insulin may be faster if you inject into a limb that will be used for the activity. For example, you may get more stable blood glucose levels if your insulin injection into the arm or stomach rather than the leg before something like running or cycling. Additional carbohydrate is more likely to be needed before and during unplanned activities when the insulin has not been reduced. Hopefully the session today has helped to identify any patterns that you may be noticing before, during and after physical activity. If you have any concerns or you would like to discuss more information, please contact the Milton Keynes Diabetes team for advice and support.